According to an estimate from the U.S. Centers for Disease Control, 44 people die every day from overdosing on popular painkillers like OxyContin and Percocet. And overdosing is just one of the dangers. Many people who get addicted to opiate painkillers transition into using heroin for the same effect at a lower cost and higher danger. Colorado is in line with a national trend of rising heroin use and overdose deaths, but it's also on the forefront of a new effort to bring awareness to this epidemic. Reporter Mary McCarthy met recently with young Coloradans who have managed to overcome their addictions to pills and heroin and who are now speaking out on how to get help.
I did pain pills for about seven years, and then they changed all the formulas and they were harder to get, and I just kind of started doing heroin. It was cheaper.
29-year-old Kurt Byrne has been clean for almost 2 years, but it's been a long and difficult road to recovery.
I was dependent on the opiates, so it was an easy transition for me because it was easier for me to acquire heroin and to stay well, and I was getting more high. But that only lasts so long, to the point where you're spending just as much money, if not more. You're injecting it.
Kurt's mother, Trish, says she considers herself lucky because her son has survived an addiction that's killing so many young people.
I enjoy every day that we have this relationship. And I hope for every family out there that they can get to the place that we're at.
They got here in part by communicating with each other, but also with the world. Trish has been writing a blog about their struggles, a blog that's gone viral, with one post, "I Raised an Addict," getting nearly 800,000 hits.
The blog itself was an accident. When I sat down and wrote, it was frustration. I write a lot, and then I pile up my computer next to pictures I don't print, and I move on. And I had sent it to Kurt, and he said, "We should put this out."
The Byrnes are part of a growing community of recovered addicts, their families, and public health officials taking on the opiate crisis in Colorado.
So it has been this Friday, it will be 3 years since I've seen the face of my son and his smile.
The JP Prescription Drug Awareness Foundation, named after J.P. Carroll, who died from a prescription drug interaction in 2012, has been working with state officials to raise awareness. And the Colorado Consortium for Prescription Drug Abuse Prevention was created 2 years ago to establish a coordinated statewide response to the opiate crisis.
If I have guns and ammo, I would treat it the same way. They're just as lethal.
21-year-old Jesse Wheeler was addicted to pills and heroin, but he now devotes much of his time to helping other young addicts, using his own success to smash some of the stereotypes associated with heroin addiction.
I don't go day in, day out and think, oh my gosh, I need to go use, because with the time that I've accumulated, that has left. I guess the biggest struggle in recovery is the stigma that's associated with it. You know, I'm very vocal about my position and my recovery. And the reason being is because of the reactions I get from other people sometimes when they hear that. They say, you used to be homeless and unemployed, and now look at you.
For these former addicts and their families, their message is a far cry from the strict Just Say No campaigns of the past. They're calling to treat former and current drug users with empathy and an open mind.
Not having a clear and open communication between parents and their children can just exacerbate it for much longer than it needs to be, versus trying to nip in the bud early on and figure out what to do about it.
Raising my kids, I said things like, I don't want you to drink. Don't drink. It's bad for you. Wait till you're old enough to know better. But if you do, call me. I'll get you a ride. You know, don't drive drunk. Don't have sex this young. You really shouldn't. But if something happens, you know, come to us. And then I said, don't do drugs. And I never said, but if you get in trouble, come. And it didn't even occur to me, because of course it's off your radar. You think, I raised a good kid. He was a good kid. He was smart. He had a brain. He knew what was right and wrong. And it just, that we'd fast forward to heroin? Not on my radar.
Be there and be ready for them when they're ready to accept the help.
So Colorado has a problem, whether it's heroin from the street or prescription drugs collected from the medicine cabinets of family and friends. 224,000 Colorado residents use these drugs in a non-medical way every year. To learn more now, I am joined by Dr. Rob Valek, the coordinating director of the Colorado Consortium for Prescription Drug Abuse Prevention. He is also a professor of clinical pharmacy at the Skaggs School of Pharmacy at the CU Anschutz campus. Dr. Valek, the statistics that are surrounding this are just so alarming, and Colorado, you say, is second in the country with this problem?
As recently as a few years ago, we ranked number 2 in what was called self-reported non-medical use that you referred to. And of course, Colorado wants to be number 1 in a lot of things, but it's not in non-medical use of prescription opioids. So the governor spurred on some strategic planning process to create this consortium to address the problem and reduce the number of Coloradans that are misusing these drugs and not using them in a medical way.
It is a very interesting setup. In fact, there's a chart on your website that shows how this is set up under the Colorado Attorney General's office. John Suthers was in on the beginning of it. And then there are all these modules around the Skaggs School of Pharmacy. So what are the various ways you are attacking this?
Yes, we have 7 different levers that we're trying to press and move to help address the problem. And they range from public awareness to help educate the public about this, that this is a big deal and we need to address it and how to do it. Safe disposal, provider education to better train prescribers and pharmacists. The PDMP, we have a state database that tracks controlled substance prescribing. We want to improve that and have it used more so we can avoid these problems. A group that deals with data, a group that deals with treatment, and a group that deals with naloxone, an overdose reversing drug.
One of the modules, as you mentioned, is the treatment module. Are there enough programs in the state to help people get over an addiction?
Unfortunately, nowhere near enough treatment. In terms of people who need substance abuse treatment and meet criteria for some sort of treatment, it's estimated that we might have about 25 to 30 million Americans that need it, but only about 10% of those actually get it in a given year. So we call that the treatment gap, and it's about 90%, which is really alarming. Most people that need treatment simply, even if they want it, can't get it.
And the consortium doesn't have money to spend on that.
We don't have money. We're like most, we're a 501c3, and we're like most of them, struggling just to get a little bit of money to do our work and raise awareness. So we don't have money, but we do advocate at our own state legislature and nationally to try to advocate for more resources for treatment.
Why is it that this has come to the point that it has? For instance, back in the 1980s, you told me earlier, actually medicines were being underprescribed.
Back then, it's when I was going through training, that was the belief was that pain was under-recognized and under-treated. So we need to make more effort to be aware of people's pain and treat it. And over time, over the 80s and 90s and into the early 2000s, there was a pronounced increase in the amount of prescribing of all pain meds, including opioids, which are the powerful addictive ones. And it's gotten just now to the point where I think the pendulum has swung from under-treatment and not enough use to perhaps over-treatment and a little bit less judicious use than we need. So we're trying to move it back to the middle, not to cut into people who have legitimate medical need. They should still have access, but to try to reduce some of the overuse and get it back to the middle.
People who get into this slippery slope may start with a legitimate pain need after a surgery, say, but then they go on and you say their first line is to steal it from other people's medicine cabinets.
Unfortunately, that's what we see is 70 to 75% of the time someone starts by accessing a medicine that was in someone else's medicine cabinet. Ordinarily, that second person has done just what you said. They may have had a tooth extracted or a small medical procedure and received a few, Vicodin or whatever after the procedure, took a couple of those tablets while recovering and just stored the rest in their medicine cabinet and didn't think much of it. But those tablets end up falling into the wrong hands of people that they weren't prescribed for, and those folks oftentimes become tolerant and start to abuse and become addicted.
So that's why part of what the consortium is doing is trying to raise awareness about disposing of medication.
Exactly. As hard as it is for people to believe, if we dispose of that, people often think, well, I won't be able to get any more pain medication. We have found that's not the case. If anything, it's almost too easy to get pain medication, so we want people to dispose of that when they're done, and the next time they have a procedure, get another small amount.
When people cannot get their hands on prescription drugs or can't afford them, the next turn is to heroin, which is very dangerous.
It's unfortunately true that we are paying more attention to the prescribed opioids, and they're very expensive on the street. So people often turn to the most readily available and least costly alternative, which is heroin. It's a lot cheaper and more easy to access heroin than it is to get prescription opioids now.
Dr. Rob Valek of the Skaggs School of Pharmacy and coordinating director of this consortium. Thank you for your time.